Story 1. My female doctor, who is now retired, once told me I had great birthing hips. I am male. Story 2. From middle school until 10th grade, I experienced violent nausea whenever I became hungry. I felt like my stomach was on fire, and I missed a lot of school despite being a good student and not falling behind. After a lot of fighting with my mother, who accused me of exaggerating, she agreed to take me to a gastroenterologist. Before agreeing to perform an endoscopy, the gastroenterologist accused me of exaggerating because I was a teenage girl, saying that was apparently what young women do. He suggested I was making up symptoms for attention, asked me point-blank if I was lying about my pain to skip school, and implied I had a mental health issue I was trying to hide. I had gastroesophageal reflux disease and severe acid reflux, confirmed by the endoscopy he reluctantly performed. Instead of letting it go, the gastroenterologist angrily told me I had the stomach of an 80-year-old man and must have been intentionally eating in a way that damaged my stomach. I have a family history of stomach problems and gastroesophageal reflux disease. I do not understand why it was considered implausible that my brother could have acid reflux at a young age, while I was assumed to be a hysterical liar when I reported the same symptoms in my teens. Story 3. When I was about 4 years old, I was diagnosed with childhood asthma. The doctor told my mom it was her fault because she had chosen to have a child despite having asthma herself. Story 4. I was in the emergency room, about 6 months pregnant, with heavy spotting and no noticeable fetal movement. The doctor was unable to find the baby's heartbeat. He just looked up at me and said, "Yep, probably dead in there." He could not have said it in a more casual, offhand manner. Note: I delivered my son 3 months later, perfectly healthy. Story 5. I'm sure it's not that bad, the intake nurse said at the inpatient psychiatric unit where I was checking myself in after a suicide attempt following a sexual assault. Edit. Thank you to everyone who commented or private messaged me. I am okay. I did a short inpatient stay, and everyone who worked there, and honestly everyone else who was also staying there, was kind, thoughtful, and helpful and seemed to be much better at their jobs. This was about 2 years ago. Things are better but not perfect. I think sometimes that is hard, especially for people in my life. They seem to be waiting for a version of me that is perfectly fine, and I am not sure she exists anymore. But it is better than it was most of the time. Sometimes it is harder, or at least similar, but I am still here, and sometimes being still here is okay as the only success of the day. I have my work, I have my son, I have my circle of people who really stuck by me, and that's a lot to hold on to. Story 6. A different kind of doctor, a dentist. He poked a sharp piece of steel into my not dead yet gums. I jumped and said, "Ow." He replied, "Oh, come on, it does not hurt that much." I looked at him, got up and walked out. I now have a very nice dentist. Story 7. He asked me if I felt lonely. I said I don't think of myself as lonely. He wrote down lonely and underlined it. Edit. Thank you, kind strangers, for the gold and silver. I'll show it to my friend. Story 8. I went to have a lump in my groin examined and had to remove my underwear. The doctor launched into a speech about size not being everything, which was irrelevant to my visit. Story 9. He said I should be happy carrying a bit of weight because, in a drought, the fattest cows die last. Seriously, what the heck? Story 10. A few years ago, I gained a lot of weight around my midsection and my period stopped. I was young and scared. I thought I was pregnant, but the tests were negative. I went to a doctor for a checkup. She ran some basic tests and told me, "There is nothing wrong with you. You are just fat." I already had body confidence issues, so hearing that from my doctor while I was trying hard to get in shape was devastating. I worked to lose weight, but my belly would not shrink. I began to feel very unwell and returned to the doctor, who again said I was just fat. I was crushed. A year later, I went to the hospital for an unrelated issue, and doctors discovered I had a giant ovarian cyst about the size of a newborn. It was disrupting my hormones and causing weight gain, among other problems. I have since lost weight and feel much more confident, but that doctor's words affected me for a long time. Story 11. I was told it's all between your ears after at least 1, and probably 2, crippling vitamin deficiencies were missed because the right test was not ordered. It took me 2.5 years of thinking I was lazy and pathetic before I went to another doctor and was diagnosed. Story 12. I was having digestive issues that I eventually learned were a result of my undiagnosed cancer. My doctor suggested I should wipe more thoroughly. Story 13. I went to have an earache checked, and the first thing the doctor said was, "I am going to put you on some medicine for the ear, but we have to do something about your face. Your acne is absolutely terrible." Thanks, doctor. Story 14. Getting out of the army, you are 100% healthy. My medical record was about 6 inches thick. I went to a civilian doctor, and the doctor was astonished that anyone would say that. I am rated 80% disabled. Story 15. The doctor said he did not understand how I could be in so much pain at such a young age, and that he would not be able to write me a prescription. I told him he was a dipshit and that I had come in because I was hurt at work doing heavy construction. I never asked for a prescription. I assumed I was getting an X-ray to see if I had broken anything. Story 16. I woke up in the hospital and heard a nurse running out saying he is awake. A doctor came into the room and told me to move my toes. I asked where I was and what was going on. He became more insistent and kept saying, "Move your toes." I said I was moving my toes, and immediately he said, "You will never walk again." That is how I found out I was a paraplegic at 21 years old. I had been in a single-car wreck and was thrown 70 to 80 feet from the car. My vertebra was dislocated and lying next to another one. I do not remember the car wreck, but that exchange with the doctor is burned into my brain, and it happened 31 years ago. I had a seatbelt on but went off a small hill next to the interstate after clipping the end of the guardrail. The car flipped down the hill, and the seat and seatbelt failed under the pressure. I went out the driver's side window. My back collapsed around the door sill and dislocated one vertebra next to the one below it. I am a big guy, 6 feet 4 inches and 235 pounds at the time, and the force was too much for the seat structure. I learned these details over the next few weeks while I was in rehabilitation. Thank you for the support and comments. I did not expect this story would touch so many people. Thank you for the awards and kindness. Story 17. I used a video chat service to talk to a doctor for 15 minutes. I told her my symptoms and thoughts because we were short on time. I had been very sick for weeks with a possible urinary tract infection and a respiratory infection, and I shared other ideas based on my symptoms. She told me I had valley fever and explained it during the chat, and the session ended at 15 minutes. I received a final email that should have included a prescription, but it said she thought I had somatic symptom disorder, also known as believing I was making my symptoms up, and that I was perfectly fine. The prescription was for a psychologist. She had told me in detail about possible valley fever, even though I said I had not been to the areas where it is prevalent. I made an appointment with my regular doctor and had several tests run. I had a respiratory infection and a kidney infection. After about 10 days of medication, I was fine. I was very upset with that provider. Story 18. You cannot be in that much pain. You must have more energy than that. It turned out the lining of my nerves was being destroyed. I was becoming painfully paralyzed. Story 19. When I was 16 and dealing with partial deafness, I was told, "Sometimes being a teenage girl is hard, but parenting teenagers is hard too. So there is no need to exaggerate and make life harder for your parents. Knock it off. There is nothing wrong with you. 2 tumors, 9 surgeries, and a cerebrospinal fluid leak later. Yes, doctor. There really was something wrong." Story 20. I had just gone through my second hip surgery following a car accident. The pain was persistent. My doctor said, "On the bright side, you will qualify for a full hip replacement in 10 years. I thought, what a terrible situation. 10 more years of this and another surgery. Story 21. This was told to me by someone I knew. I work at a hospital, and so does my mother. We had a 43-year-old woman who had a very rare form of cancer that spread incredibly fast to almost every part of her body. The time from diagnosis to death was about 12 weeks. Medications, therapies, and her general lack of mobility caused her to become swollen and obese. She was a terribly sweet woman. They took her down to radiology for a scan, and the technician made a number of mean comments about her weight because she was too large for our machines. They had to arrange a transfer to another hospital for her scans and then transfer her back. The technician assumed that because Miss Jeannie was dying she was deaf or no longer understood English. While they were alone, the technician made many cruel comments. Miss Jeannie waited until she was back in her room, awaiting transfer, before she started crying. I will never understand people who feel the need to make others feel inferior. I do not know the whole story. I only knew her for a few weeks while she was with us in the hospital. Pictures from as late as 6 months before diagnosis show she was only slightly above average in height and weight. I imagine her inability to move and care for herself contributed to the weight gain, but I am not a doctor and cannot diagnose. The technician in question is still employed here and is a woman. Story 22. After years of fertility treatments, we finally got my wife pregnant. Just before the 12-week mark they found something. The something was anencephaly. Not knowing what it was, we kept asking doctors what this meant and received technical answers. The prognosis isn't good, or it presents significant challenges to the fetus. All of which made it sound bad but somehow manageable. As we continued seeing a series of doctors, we eventually saw one with a declarative Scandinavian accent. When we asked him, "What does this mean for the child?" he answered, "This condition is incompatible with life. If it survives to birth, it will live only for days." It was at once soul-crushing and a relief. We finally knew how bad it was, and we knew what we had to do. The decision was no longer ours, and while it hurt, the clarity was welcome. Recalling this story many years later still makes me feel emotional. Story 23. I finally worked up the courage to address my mental health problems and asked my doctor for a recommendation to see a therapist. His only response was that my health insurance was inadequate and I could not afford a therapist. That was a bad day. Update. I do not know if anyone will see this, but in perfect timing my university was recruiting therapy participants for a study. I now have 6 two-hour therapy sessions booked for free. I am so happy. Thank you for all the replies and suggestions. I am very appreciative. Story 24. When I had a kidney stone, why did you come to the emergency room? Why didn't you take acetaminophen or something? This is a waste of resources. He made me cry. Story 25. My doctor suggested I have a baby because my nether regions were too tight and were causing discomfort during sex. Yes, shit a screaming ham and see if that increases my pleasure. Story 26. As a doctor, I have to tell you something that not many people are willing to admit. About 10 to 15% of the health professionals I met during medical school are awful human beings who do not belong in medicine. They lie, cheat, and do not care about people. On the flip side, about 15% are some of the greatest doctors you will ever meet. They follow up with you and care for you like you are their own family. 70% fall somewhere in the middle. The point I am making is that being a doctor is not only the pursuit of those who care for others but also a representation of our society as a whole. Story 27. Not necessarily psychologically hurtful, but the most terrifying thing I have ever been told. We're going to have to defibrillate you and we don't have time to sedate you. They rolled the crash cart with paddles into my room, and I said, "Get that thing the fuck away from me." I almost cried. My mother was in the room and was hysterical. Thankfully, a cardiologist was able to look at my electrocardiogram in the nick of time and determine my heart rhythm was stable enough for transfer to a room for further evaluation without defibrillation. Story 28. When I was 21, I went to the doctor for a checkup. The doctor asked me to lift my shirt, and I did. He immediately said ugh and looked disgusted. I was gaining weight too quickly, so I had stretch marks. I have lost the weight and am at a normal weight now, but I still cannot shake that moment. That was 8 years ago. Story 29. When I was between 5 and 8 years old, my mom took me to the dentist. He was probing above and under my tongue and inside my cheeks with the tool dentists used to clean teeth and remove plaque. He warned, "If you cry, I'm going to start over." I did cry during a routine procedure and he started again. No needles were involved. Story 30. I started seeing a dentist who had been highly recommended by several people. When I asked about straightening my front teeth, he said, "Well, you'll never be on the cover of Vogue, but I think we can help you." I stopped going after a few appointments when he became upset because a filling he had placed months earlier still hurt. Story 31. When my wife was about 8 weeks pregnant, she went to an oncologist's office after her obstetrician gynecologist found a polyp and wanted someone to look at it. Doctor, you need to have a hysterectomy immediately. Us. Shouldn't we wait until the biopsy results come back? Doctor, no. In my opinion, if you want to live, you need to have a hysterectomy immediately. Turned out to be benign. Discoloration is normal for Pacific Islanders during pregnancy. The doctor received the biopsy results the next day, but we were not told until the following week. To those who asked, we waited. Our son is almost 16 now, and we never saw that doctor again. I knew he received the biopsy results the next day because my mother-in-law was also a doctor and the pathologist who handled the biopsy was a friend. I edited this to fix a typo and clarify. We decided to wait the week for the biopsy report and to seek a second opinion. Story 32. The doctor said to 15-year-old me, "What are you going to do if your boyfriend would rather you had bigger boobs?" I was getting a consultation for a breast reduction because sporting a G-cup was a fucking nightmare. I still have them. No regrets. Story 33. Doctor, I can tell you're incredibly sick by your skin. Me looking in the mirror, oh no, I always look like this. Doctor. No. It's gray and sallow, and the heavy dark circles under your eyes make you look very unwell. Me really. I swear I always look like this without makeup. I did look exactly as I do on a daily basis, apparently deathly. I should add that I was in the accident and emergency department at the time because of a kidney infection. I am now totally fine, but I still looked the same that morning at 4 a.m. Story 34. The doctor told my mother. Not me. Oh, just let him hide in the bathroom. I hid there when I developed severe headaches that were later found to be caused by a brain tumor. The doctor must have assumed I was masturbating. Story 35. When I was 9, about to go under anesthesia for the first time for oral surgery, I was extremely scared. The nurse told me I needed to grow up and that she had seen children half my age who were not as scared as I was. My mother was not by any means a helicopter parent, but the scolding she gave that nurse, the other nurse who had chuckled, and the doctor who came in was fierce. Then she took me out of the office for ice cream. The surgery was not time-sensitive. It was only to correct an adult tooth that was about to become impacted. I had the surgery at a different office with staff who had much better bedside manners. Story 36. My doctor did not actually speak. His reaction was worth 1,000 words. He rolled his eyes, threw his head back, and sighed loudly. I had a semi-regular abdominal cramping pain for years. The cramps doubled me over, lasted a day or two, then went away. Several doctors could not figure it out. I mentioned the pain to a gastroenterologist I was seeing for another problem. He ran tests, tried treatments, performed an endoscopy, and said he could not find anything wrong. The next time I had the cramps, he repeated his nonverbal routine. It would have been less hurtful had he called me a hypochondriac. I gave up trying to figure out the pain. Years later, during a bout of cramps in the middle of the night, I vomited, briefly passed out on the bathroom floor, and somehow made it back to bed and slept. In the morning, I needed to vomit again. My wife accompanied me, and I passed out on the toilet. She called emergency services, and I was taken to the hospital. The doctors quickly determined I had a bowel obstruction. After 6 hours of surgery and a week in the hospital, I came home feeling better than I had in years. It turned out I had a 99% bowel obstruction caused by adhesions that had developed on my intestines after an appendectomy in 1980. The surgeon said the intestines were twisted in places, describing it as a rat's nest. The surgery was in March 2017, and since then the cramps have not returned. I had not felt this good in decades. Summary. Doctors had been unable to identify the problem for almost 20 years. The obstruction was caused by surgery 37 years earlier. Note: my original appendectomy in 1980 became infected and required a second operation. That 8-hour operation left a 9-inch scar. The adhesions gradually restricted intestinal movement, causing intermittent intense pain and constipation. An exploratory laparoscopy ultimately identified the problem when it became an emergency. I had corrective surgery, recovered, and my bowel function is much improved. Story 37. The emergency room staff made me wait 6 hours with a dead organ inside me and treated me as if I were being a drama queen, even though I was in severe pain. Thank you to everyone who reached out to wish me well or to share their own stories of overlooked and dismissed pain. I hope you are all healed and doing well. To the people telling me it is not that bad because I did not have a heart attack, a stroke, or die, I hope your internal organs never suddenly fail. That would be terrible. Story 38. Someone suggested that I had confused a panic attack with a seizure. To clarify, this was my first grand mal seizure. My father had experienced them before, and my mother witnessed both his and mine. According to her, they were identical. I even exhibited all the textbook signs of an epileptic seizure, from memory loss to postictal fatigue. The emergency room doctor did not run any tests or examine my family history of epilepsy. He only noted the anxiety disorder in my medical history, assumed I was having a panic attack, and wrote it off as simply a head injury. My psychiatrist later confirmed, based on my account and my mother's details where I could not remember, that I had a seizure, and he ordered further testing. He also said, "What the fuck is wrong with this doctor?" I'm glad that at least one of my doctors took me seriously. Story 39. You are 19. You should not be having problems with anxiety. Edit. Jesus Christ, this blew up. Thanks for the support, guys. Edit 2 Electric Boogaloo. Thanks for the Reddit gold. An anonymous user. Story 40. It is unethical for women who have never given birth to obtain an intrauterine device. You will change your mind about not wanting children. You are too young. Story 41. The new doctor took my height measurement, jotted it down, and made a casual remark. Huh? Tall for a woman. I am a bearded man. Story 42. When I was in high school, I went to the doctor for a sports physical for basketball. I was 140 pounds and 5 feet 9 inches. He told me, "You need to lose a few pounds and then you will make the wrestling team," while winking. That comment about my weight as a teenager has stuck with me for years. Story 43. I went to the emergency department with my friend, who was 9 months pregnant and due any day. The doctor asked which one of us was pregnant. My friend was lying on the chair bed and I was sitting in a chair. I started laughing like a hyena because I was so mortified. Story 44. What chronic illness are we sick with today? I was 12 years old. Puberty was overwhelming. I was depressed and frequently ill because my home life was in shambles. My mother dressed well and was a well-known figure in the community, so people assumed I was faking my illnesses. When a child acts out for attention, I pay attention because it means something is going on. That doctor shamed me into a pit of despair. I have had trouble trusting medical professionals since. Story 45. Doctor glances at my genitals. You have herpes. Me. But I've never had sex. Doctor. Oh, stop crying. I see this all the time. It's pretty common. Me. But aren't you going to at least do a test? Doctor. Fine, but it will hurt and it will show herpes. Indeed, it was an allergic reaction to a medication. Edited. Wow, thanks for the gold. I appreciate it. Story 46. I hadn't been able to eat in days. I was throwing up, had been constipated for a week, and had severe stomach pain. My girlfriend finally convinced me to go to the hospital. We went to the emergency room and were taken to an examination room. My girlfriend came with me. A male doctor came in, looked at my chart, and said he needed to perform a rectal examination. Before I could say anything, he had his large fingers inside my anus in front of my wide-eyed girlfriend. He then said, "You have prostatitis. This can happen when you are sexually active with multiple partners," and walked out. I had never cheated on anyone, and I had to explain that while I was still sick. I saw my primary care physician the next day. It turned out I had a stomach infection. Oh, hi, Tyler. My roommate reads my Reddit and now knows I was rushed by Dr. Big Fingers. Story 47. I told the doctor I did not know what was wrong and asked what they wanted me to do while crying on the examination table and asking for help with my pain. I went 10 years with an undiagnosed condition. I was repeatedly told it was just cramps and accused of seeking medication. It turned out I had a cyst the size of a grapefruit that was twisting one of my ovaries. It was not just cramps, and it could have become septic if it had ruptured. Story 48. You aren't going to die over the weekend or anything. I had not eaten or had anything to drink in 6 days or so, other than sucking on ice. It turned out I had burned a hole in my throat and had to be admitted to the hospital the next week. The doctor who told me this said I was in pain because of my diet and that I should go vegetarian. Update. Many of you are asking what medication it was. We think it was caused by a mild antibiotic prescribed for acne. Update 2. I did not have a hole going all the way through my body, but my esophagus had a hole in it that was black and necrotic. I was scoped at the hospital, so I had a photo somewhere, but I am sure I have lost it at this point. I had to be put on morphine to be able to eat for the first time. Doctors wanted me on a feeding tube, and I was on intravenous fluids for 2 days. And screw anyone who says I did this to myself. I was a teenager when this happened, and not one person warned me. None of the doctors or pharmacists said a word about me needing to be cautious. Story 49. When I was 14, I was raped by a 20-year-old man. I was at the hospital, and the doctor who examined me did not believe me. He asked if I was lying to get attention. I had never felt so lost. Story 50. When I went for a repeat prescription for antidepressants because I was suffering from postnatal depression, anxiety, post-traumatic stress disorder, and obsessive-compulsive disorder, the nurse refused to prescribe them and told me, "Just cheer up. It is almost Christmas." Silly me. Why did I not think of that first? Thank you for my first ever silver, kind internet stranger. Story 51. When I was a child, I went to the doctor's office because I was terribly ill and vomiting. The doctor asked if school exams were coming up. I said yes. She said, that explains it, and rolled her eyes. Story 52. Not about me, but about me. I was born with a cleft palate and lip, and the doctor turned to my mom and said, "At least he'll be able to grow a mustache." I'm female and was a newborn at the time. It actually made my mom laugh. Story 53. About 3 months pregnant, I started spotting. I spent about 10 hours at the hospital undergoing a vaginal ultrasound and diagnostic testing. They said there was nothing they could do and told me to go home and wait to miscarry. I was a wreck. It was late, dark, and raining, and I had no way to get home because my husband was at work with our only car. I was very young and poor. The doctor said the nurses had taxi vouchers they could give me to get home. At the nurse's station, I asked for a taxi voucher. A nurse told me they only give taxi vouchers to women who have living babies. I am a long-time lurker and do not post much, so I was still learning the ropes. Thank you for the gold, silver, and platinum awards. I learned that trying to respond to comments on mobile does not work very well. Thank you for all of your kind words. If you take anything away from this, let it be that young people sometimes need a little help navigating life. That one comment from the nurse caused me years of being afraid to ask for things for fear of being not only turned down but also humiliated. In summary, try not to be a dick. Story 54. Your baby is not going to survive. The hospital charged us $85 for that 2-minute conversation. We had that conversation 3 times for 3 different situations within a month or 2. She is now 10 years old. Update. Thanks for upvoting. This replaced my previous top comment, which was about a group of nurses assuming I pushed my pregnant wife down the stairs. Fun fact, I did not. Story 55. I am an Indian woman. I cannot go to most gynecologists here because they are so judgmental. My last visit was brutal. I was slut-shamed for losing my virginity before marriage and then given an extremely painful transvaginal ultrasound. When I yelled out in pain, the doctor said, "But you were used to things inside you." It shook me to my core. I cannot summon the courage to visit a gynecologist anymore. Update. This happened in New Delhi, India. Story 56. You were just another crazy and stressed woman. Turns out I had a heart problem he just could not diagnose. Story 57. I saw my local doctor about my mental health, which took a turn for the worse after I was assaulted in the street. He then went into a lecture about how I perceive things, to the point where I had to remind him that I had been assaulted for no reason other than that the other man was bored and showing off to his friend. The doctor berated me for thinking of the assault in a negative way. I did not realize there was a positive to having a visible wound on my face. Update. Thanks for the comments. To clarify, the doctor was a general practitioner, not a psychologist, and there was a student doctor in the room, so who knows what impression that left. The wound healed and the scar is now barely visible, so there is nothing left for anyone to notice. Story 58. It is a toss-up between the doctor who told me I was lying about being raped and the doctor who told me I was a typical teenage girl acting out for attention when I said I was suicidal because of the rape. Story 59. Maybe your migraines are happening because a physics major is just too advanced for you, young lady. I graduated with honors and earned a master's degree for good measure. Story 60. I went in for something completely different and she commented on the stretch marks on my hips and around my breasts. I was about 17 and had gotten them during puberty because I developed so quickly. I explained this and she talked to herself, saying she had originally thought I had been fat and then lamented that I would have to live my whole life with a body like that. I changed doctors the next day. Story 61. I was in a skiing accident when I was 16. For 4 years I kept seeing various doctors because my joint and muscle pain gradually worsened. I sometimes woke up at night crying. They dismissed me and said I was not stretching or exercising enough. I danced 4 times a week and did cardio on my off days, so that was not the issue. When I was 20, my mother took me to her rheumatologist because arthritis runs in our family. The doctor diagnosed me with fibromyalgia. There is no real cure. It will probably be with me my whole life and could get worse. For about 3 years, every doctor I saw after that acted like the diagnosis meant they did not know what was wrong and ordered yet another blood test, even though I had already had around 30 tests. Others told me I was too young for this pain and suggested I was exaggerating or that it might be a phase. Eventually, I began pushing back when doctors said things like that. I am 28 and I still have it. Story 62. I'm not sure if psychiatrists count, but she told me to stop talking about my past and said she had other patients who had it worse than me. I had only been seeing this woman for 2 months. It had taken me years to work up the courage to seek help because I feared my problems were not real or important. We had barely touched on the problem I had come in for because the doctor decided in the second week that I had generalized anxiety disorder, and that was that. Story 63. After multiple car accidents, confirmed spinal damage, and referrals to chronic pain and spinal specialists that confirmed why I was in pain, my general practitioner said maybe it is all in my head. I was vomiting from pain flare-ups in her office. This was after she made me fight tooth and nail to get the help I needed. My new doctor actually wants to listen to me and he is amazing. Story 64. Freshman year, the night before a really big day of exams in biology, chemistry, and oceanography. I suddenly noticed I was bleeding from my rectum, nearly constantly, and it did not stop for 4 hours. I am a woman, so blood itself is not a problem, but it was very frightening to have it coming from the wrong place and not stopping for that long. Finally, I went to the emergency room because my roommate was sick of me freaking out and the campus clinic was not open at 1 a.m. In the 4 hours I waited in the emergency room, the bleeding apparently stopped. The person who checked me said it must be residual period blood and that I was wasting their time. I still have this issue occasionally, but I am terrified of being called a faker. Edit. Please stop telling me I may have cancer. I know one comment was enough. I have scheduled an appointment. Story 65. I once phoned a doctor about a lump I had found on my testicles. He asked if it was black and the size of a tennis ball. I said no, and he said it was nothing to worry about and hung up. Turned out to be a cyst. I had it checked and was fortunately fine. I did not expect my testicles to swell so much, but I had hoped they would one day earn me a gold medal. Thank you, kind sir. Blessings of Stender upon you. Story 66. You have a lot wrong with you for someone your age, don't you? Fuck you, doctor. Story 67. My doctor prescribed a different kind of antidepressant during a particularly hard time to see if it would work better. I had a follow-up review with another doctor 6 weeks later. I told the doctor that the new medication was not making a difference and that my previous medication had helped more, and that I was now barely able to get out of bed. The doctor joked that it was probably because it was January and I was just feeling bad about the weather, and said they probably should not give me a morning appointment. They laughed. Story 68. The doctor told me there was nothing she could do for my mother, who they said had lung cancer. She ended the conversation by dismissively saying the patient had smoked, then scoffed and walked out. My mother had quit smoking 20 years earlier. I had seen lung cancer in other family members and knew this was not the same. I decided to have an autopsy performed. Turned out she had breast cancer, not lung cancer. Unfortunately, they did not realize until it was too late that her heart was failing, and they were unable to perform exploratory procedures. Story 69. I suffer from severe depression and anxiety. I have managed to live a normal life until last year. Due to work-related stress, I had a severe breakdown. I was on my third type of antidepressant and on Xanax for sleep. I specifically remember my doctor saying, "Unless you are lying to me," while he completed the paperwork for my medical leave. I remained shaken for days after the breakdown. It really hurt that he said something like that, given my history of mental illness and how deeply it runs in my family. I did not return to him, and I have been off medications for a few months now. I actually feel okay. I would like to find a new doctor after I have insurance again. Story 70. I am having a miscarriage and bleeding an amount that online sources say is not normal. I am extremely dizzy, freezing, and losing feeling in my extremities while waiting in the emergency room for a doctor. When a doctor arrives, I will be taken to surgery, put under anesthesia, and have a uterine aspiration because my body cannot complete the process naturally. Before that happens, while I am trying to tell a nurse how badly I need help, I say that I cannot feel my hands, and she replies, "That's because you are hyperventilating. Try to stop that." I am bleeding heavily. Hyperventilation can be a symptom. Please be gentle with someone who has not only lost their child but is trying not to go with them. Story 71. If you were trying as hard as you say you are, you would not be so fat. The next general practitioner I saw took me seriously, diagnosed me with polycystic ovary syndrome, adjusted my medications to balance my hormones, and connected me with specialists who provided a tailored diet and exercise plan. It has been 18 months since then, and I am just over 26 kilograms lighter, about 58 pounds, and I am consistently keeping it off. My other polycystic ovary syndrome symptoms are mostly gone, and I finally feel like the outside matches the inside. Edit. Reworded for clarity. Story 72. I had my pants down while being examined for a hernia. Doctor, are you able to get an erection? Me, that is an erection. Note, many people ask why an erection is needed for a hernia exam. It is not required. The doctor was asking if I could get one, since a hernia can affect your genitals, and the doctor was just checking. Story 73. He told me I had bipolar disorder and panic attacks because I was fat, and he refused to help me find medication to manage my symptoms. This was particularly troubling because he was a psychiatrist and that was his job. Luckily, I was thin at the time of my diagnosis 5 years earlier, so I knew he was wrong. I always wondered how many overweight people he did not properly help. Story 74. I had just learned I was pregnant and was in shock, still trying to process the news. The obstetrician-gynecologist walked into the room and said that I had an unwanted pregnancy. I was stunned that he started our first visit that way. Story 75. My first gynecological exam was nerve-wracking. I had lost my virginity only a few months earlier and was seeking birth control. The doctor said I would be too absent-minded to take a pill every day and recommended a hormonal intrauterine device. Because of my migraine headaches and a family history of blood clots, that was not a good option for me. During the exam, the doctor attempted to insert the speculum while I was very tense, which made it uncomfortable. She told me I should drink wine to relax and have sex more often to stretch out before she would consider giving me an intrauterine device, and that she had used a smaller speculum. I never returned, and Planned Parenthood was a lifesaver. Story 76. My wife was run over by a car while waiting in line at a bakery. A woman was parallel parking and hit the wrong pedal. My wife almost died and was in the hospital for 2 weeks. One doctor came in to check her progress and said, "Maybe next time you will look both ways before you cross the street." Story 77. The psychiatrist who told me I was wasting my parents' money by being there ranks pretty high. It was a brilliant thing to say to someone so anxious and depressed they could barely leave the house and already felt like a worthless piece of shit for being a burden on their parents. Story 78. You are just constipated. I came back shortly after with an appendix that was about to burst. Story 79. Do you know you were fat? No. The beer gut and B-cup man boobs are just an aesthetic choice, obviously. Story 80. I had to take my son to the emergency room when he was 2 because he was having trouble breathing. The emergency room doctor said he most likely had asthma and gave us an inhaler. Flash forward 3 days, when we went to his follow-up appointment with his pediatrician. Dr. Jackass. So he saw that emergency room doctor once and you trusted her to make a lifelong diagnosis that your son has asthma? That's pretty ridiculous. 6 months later, after 3 more emergency room visits in which my son could not breathe, Dr. Jackass said, "It looks like I owe you an apology. Turns out your son quite likely does have asthma." Story 81. I went to a gynecologist at our university hospital in New York for a routine checkup. While she was examining me, she asked about my personal life. I told her I have a boyfriend and she replied, "Are you sure he does not cheat on you?" I was shocked. Asking someone that while they are most vulnerable is inappropriate. If I had repeatedly come in with sexually transmitted diseases and did not know the source, it might make sense, but this was my first visit and there were no problems. What was she thinking? Story 82. I went in for an update to my glasses prescription a year ago. The doctor had been our family optometrist for a long time and was friendly with my mother. Doctor, are you on any medication? No. Well, just birth control. The doctor made a disappointed face and said, "Oh, I didn't think you were like that." Or something like that. She did not think I was that type of girl. Doctor, I am married now. The doctor looked relieved. "Oh, that's good. Congratulations. When are you having children?" We are not sure if we want children. She moved on with the exam, and as we were finishing, she asked about religion and whether I go to church. I told her no, I do not belong to a church and I do not go regularly. She then said she was grateful my husband and I were not having children because the child would not be raised in a Christian home. I was speechless. She told me she had been suspended for preaching to her patients in the past, but that she did not care and would keep doing it. I really wish I had reported her or at least stood up for myself. I am a woman and at the time I was 25 years old. So what if I was on birth control? Even if I had not been married, she shamed me in a place where I should have felt safe. If only I could go back in time. Story 83. 3 different therapists, while assessing me after 3 separate suicide attempts, accused me of being sorry for myself, looking for attention, and drug seeking. They told me that my suicide attempts were selfish, that I did not really have problems and they did not know what I expected them to do, and that I should be more grateful. It was an awful way to spend more than 15 years of my life, and I can understand why people never return to therapy after making attempts. I am fortunate to have finally found a good therapist, but it has taken me more than 2 decades and more than 9 attempts, and I can barely afford the one I am seeing now. Story 84. Not me, but my mother. She endured severe pain toward the end of a vacation for a few days. When she finally went to the hospital at home, she was immediately admitted and scheduled for surgery. It turned out her gallbladder had ruptured, something that has happened to nearly all 6 of her siblings and one of her parents. After several days without eating, first because of the pain and then because the doctor ordered it, we asked if she could have something to eat. He laughed and said, "Don't worry, she won't starve to death. She has plenty to spare." My mother is overweight, but the doctor was no slimmer. When he repeated the same wisecrack to her face, I told him off quickly. Story 85. My 20-year-old niece went to the emergency room in horrible pain. The doctor assumed she was there seeking opioids and struck her hard in the middle of her back, where she said it hurt. She almost hit him back and screamed, "What the fuck is wrong with you?" It turned out she needed her gallbladder removed. Story 86. In my younger days, I was using chemicals at work that I definitely should not have been using, and I became very sick. My tongue turned white, melamine white. It looked like plastic. I went to my doctor. He asked what was wrong, so I stuck out my tongue. He looked at me, visibly shocked, and swore. For anyone who wants to know, it was tetrahydrofuran, a solvent. I was using it all day as a cleaner, soaking cloths and wiping down with my bare hands while breathing in the fumes. I do not remember how they treated it, but it put me out of action for a couple of weeks. Story 87. I had massive abdominal pain. The doctors could not determine the cause because all the scans showed my appendix was not enlarged. Finally, a doctor referred me to a general surgeon. He assumed I, a high school senior, was trying to skip class. He did a very rough exam and pushed with full force on my abdomen. I cried out in pain. He aggressively said he would just go ahead and perform the appendectomy, but if that did not fix it, I would have to live with that kind of pain because I was a woman. It was the first time anyone had ever said that to me. There were many more. It turned out the reason I was in so much pain was that endometriosis had adhered to my appendix. Removing it helped at the time, but I required more surgery later and probably will again. I have never forgotten that man, and I still cannot believe women are expected to be in pain. Story 88. When I was about 9, my pediatrician, who had been my doctor since I was born, told me I was overweight and asked if I wanted to be a fat pig. I know it was meant as a wake-up call, but I was only 9. I barely knew how weight gain and loss worked. I should point out I was only 1 kilogram or 2 pounds over a healthy weight. Story 89. I am a 34-year-old man. I was having heart problems toward the end of July last year. After a hospital stay, I returned the next day with pneumonia. One day my doctor told me that even though I felt awful, I was actually pretty healthy. 2 days later, another clinician came back into my room and said that my health was poor for a 34-year-old man. Then she told me I have end-stage cardiomyopathy. I cried for the rest of the day and called her the next day to say I did not want her treating me anymore. She also gave me at least 4,000 milliliters of sodium chloride while I was in the intensive care unit. With congestive heart failure, you should not be given large amounts of fluid or salt. I am still considering legal action. Story 90. I was neither the patient nor the physician, but I was there and was blown away. A pregnant patient was in the hospital with a diagnosis of pulmonary hypertension. The physician entered and said, "I told you not to get pregnant again or you would die. Guess what? You are going to die." Story 91. I think my birth control may be affecting my sex drive. The male obstetrician-gynecologist said no, that is not a side effect. When he asked if I was currently pregnant, I replied jokingly that I hoped not. He said, "Well, someday you may want to be pregnant and I will be here then." I thought to myself, I doubt it. I think I need to switch. Story 92. He said my brittle asthma was just because I was fat and lazy and that I needed to lose weight. I had been a perfectly normal size until he had put me on steroids 6 months earlier. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.